Hello, everybody. It's great to be here one more time today. My name is Gary Fowler. I'm the CEO, president, founder of GST Get Shit Done Venture Studios, a premier AI and quantum venture studio located in the heart of Silicon Valley. For all of you new to GST Presents is a show where I bring you the innovators, visionaries, and founders building the future before the rest of the world even sees it coming. My conversation today is one that could fundamentally transform healthcare as we know it. For decades, medicine has largely been reactive. We wait for systems, we wait for abnormalities, we wait until disease progresses far enough to finally become visible. But what if AI could move healthcare upstream? What if we could identify risk before damage occurs? Joining me today is Patañjali Chary, who's the founder and CEO of Fourth Vital, an AI native medtech company focused on upstream kidney risk intelligence using non-invasive biosensing and artificial intelligence. He brings more than 30 years of experience across AI, enterprise software, product, and design, including leadership roles at companies like Oracle and Microsoft. He studied comp sci and artificial intelligence at the University of Toronto and earned MBA credentials from both Columbia Business School and UC Berkeley. But beyond the impressive resume is a deeply personal mission. After losing his mother to preventable acute kidney failure, he set out to build technology that could help detect risk earlier and potentially save lives. Today, we're going to dive into the future of AI-driven preventative healthcare, non-invasive biosensing, the economics of early intervention, digital biomarkers, and what happens when artificial intelligence begins to predict disease before traditional medicines even begin to see it. So with that, I'd like to welcome to the show. Hello,
Patañjali. Hi, Gary. Thanks so much. Really great to be here. Delighted to chat with you. And thank you for the great introduction as well.
You know, your journey into healthcare AI was deeply personal, right? Yeah. And so, you know, and I understand it. I went down through and built a remote patient monitoring system based on my dad because my dad had had a stroke and all that. And when it touches home, you feel it in your soul, right? Can you share the story behind Fourth Vital and how your mother's experience shaped your mission?
Yeah, so about 15, 16 years ago, my mom got diagnosed with acute kidney failure and passed away just a few months later. And I think losing a loved one, regardless of the circumstance, it's very, very difficult. But in this case, being an engineer, I was very curious. Why weren't there any warning signs? Why weren't there any symptoms? And when I dug into it, I was astonished to learn that close to 1 billion people, over 850 million in the world, have kidney disease, and 90% have no clue until it's too late, like my mom. And as I dug deeper into it to understand why that's the case, the current methods of detection are leveraging most primarily biomarkers, blood and urine biomarkers, which unfortunately only detect once the damage has occurred. And so because it's irreversible and there are no symptoms until often it's too late, there isn't an opportunity for physicians to intervene. And so I started to look to see if there were signals in the body that actually could predate kidney damage and actually show the decline beforehand. And I found several signals, and we are leveraging one of them primarily today and others in the future to detect kidney decline through physiological changes earlier than blood and urine markers, thereby giving physicians the ability to intervene and take steps. And many physicians will tell you if they know earlier, there are many things that they can do to change that trajectory. And by changing that trajectory, eventually we hope it can be prevented. But even if we can get existing kidney patients identified earlier, stratified earlier, and physicians can intervene earlier, it means they don't need to suffer like my mom did. And watching a loved one go through this is really horrific. I don't wish it upon anybody. And I think whatever we can do to really reduce that silent suffering that often happens because it's too late. So many families are astonished that after diagnosis, they don't live for very long. They usually crash into dialysis or they basically reach the end of life, which unfortunately was my mom. So nevertheless, I think that today, with my background, as you mentioned, I studied AI actually before anybody cared about it. The funny story is I was actually a student of Professor Hinton's at the University of Toronto. He was one of my professors. And when I graduated with the degree, I couldn't get a job because employers looked at my resume and they said, what is this artificial intelligence thing? That sounds like sci-fi. And once I got rid of it off my resume, I started getting job offers.
Wow, that's fantastic. You know
And
the the thing that's interesting. So I went down through it because I had stage 3 kidney disease myself, and I was told the same thing, Patañjali, that it can't be cured. But I'm leaving proof that it can because I did it with mesenchymal stem cells from the umbilical cord. In fact, within 1 week, my stage 3 kidney disease was completely eliminated.
amazing.
I don't have it, right?
Yeah.
So the other thing is sometimes you got to listen to what the doctors say and take it with a grain of salt because these frontier science is exactly with the kind of things that you're doing, and then combined with what I've done. I mean, it was a miracle, actually. I got to be honest with you. When I got diagnosed with, got it because of ibuprofen, by the way.
Oh, interesting. Yeah.
I had
Okay.
taken too much ibuprofen because I had sciatica so bad on my back that I couldn't walk. And I was dragging my leg. In fact, I would sleep at nighttime with the tennis ball and a piece of plywood because I needed something really hard. And I remember one night it got so bad I had a heating pad, I had a tennis ball, and it burned my skin because I had to keep it up so high to be able to feel good. You know what I mean? It was unbelievable. And I remember I going into the dentist for my annual physical, and he said, "Gary, we got a real big problem here." I said, "What's that?" He said, "You've got stage 3 kidney disease."
Oh my God.
And so I used my artificial intelligence, my 14 large language models, and I said, go through all the research in every language on the planet. I need to come up with a solution. And what it did for me was a miracle because it came back and said that the umbilical cord stem cells live could profoundly help this and potentially eliminate it. So I remember it, and literally 3 weeks after I found it, I found a clinic in Thailand. I actually physically went over, and my stage 3 kidney disease was gone in a week.
Amazing.
And
Amazing.
so the thing is, the problem is these frontier sciences like yours, and like the problem is people just don't know. We don't know what we don't know. And it's you can appreciate that. It's an infobesity problem.
Absolutely. And, I think part of this is that, um, you know, scientists who have been focused on their particular discipline for a long time, and obviously many of them have become experts in that domain because they've studied it their entire lives. The issue is sometimes you need somebody looking from the outside and looking at the problem differently and asking questions that they won't traditionally ask. And that's exactly what happened here. I started asking questions, why, about certain things, which people just assumed, right? People assumed that only UACR and EGFR are the indicators of kidney disease. And trust me, if more people got tested, as we knew from the Super Bowl ads, absolutely, it can be detected much earlier. But it's also detected too late, right? And yet the body naturally is giving off so many bioelectrical and other signals that actually have shown in research correlations to the onset of many disease states. And so why aren't they being measured? Well, how often do you have, engineers and physicians sitting together and looking at this from different lenses and coming up with...
They don't have time. You talk to the physicians, they don't have time, right?
Yeah.
And the engineers are so busy in their silos building stuff that they're focused on that. The problem is, they don't have time. They're trying to figure out if they can pay back their student loan for their medical school, right?
Yeah.
And run their practice so they're not in the hole every month.
And look, as you know, probably where a lot of the capital has gone, a lot of the startups in the healthcare space has been to make more time for physicians by making their workflow more efficient. There's just an enormous amount of paperwork, right? Our key medical advisor and soon to be co-founder, has spent his career as an internal medicine specialist and also in palliative care. And the amount of paperwork that these physicians have to do late at night, it's crazy. So there's no question that there's efficiencies to be had there, and AI is already demonstrating how it can improve that. But that's not all. And, I'll tell you, I'll go back to my undergrad studies at the University of Toronto. And you've heard Professor Hinton give lectures on the connection between healthcare and AI. I can tell you very early on, that was one of the main things that was
Yeah.
being studied and that we were learning about. But it wasn't about making things efficient, although, of course, that question came up. It was about how can we understand the human brain? Can we computationally represent the human mind in a way that we can understand how to help people and basically understand disease better? And
Yeah.
that was really the whole impetus for AI. And so that's, the idea was once we have enough compute and we have large enough data sets that we can traverse in, without waiting, 6 months on a Cray supercomputer, then we could actually have enough computation and algorithms to actually look at the permutations and determine these things. So that was the initial idea. Of course, since then we've really evolved in the way these models have been built with transformers and things like that. But really, what it comes down to is how can we use AI to move healthcare detection upstream, earlier than current biomarker methods. And one of the things that we found is that there are many bioelectrical signals in our bodies that are sending messages, and each of us individually, the human body creates unique signatures that are unique to you. And what we're doing is by detecting, starting with one of these signals that currently all physicians, when I tell them what we're doing, they're kind of like shocked, because today in medicine, it's like, well, you can't do that except in the OR. And they're like, yes, you can. We're doing it non-invasively and we can do it from the home. But by creating a personalized vector for a patient, we can actually watch, a physician can watch that vector change real time remotely and see when it starts to it starts to sort of get close to one of the bad kidney vectors, and then intervene and watch it veer off course. So in other words, giving physicians the opportunity to identify these patients at higher risk upstream because they're actually getting further along to a space where they can't return, being able to intervene at that point and watch that change the trajectory. That is not only profound for patients, it's profound for physicians. And this is literally where AI started, I would say. It was one of the main things that we were all studying. And I was an undergrad, right? Even at that level. And still today, it is, I would say, one of the greatest applications is in healthcare. But what you see right now is so much capital and time put into workflows downstream, which is very important. But once we start going upstream, I think that's where we can turn the table, where we can really start to have an impact globally on not just kidney disease, but many other diseases as well.
No, I mean that's it, right? We don't know what we don't know. Somebody just asked, by the way, in the comments, they wanted to hear if the cancer vaccine that I built for my dog could potentially work for humans. It's absolutely. I mean, it's not. I didn't go down that road with it, but when you start to, within a month we built a cancer vaccine at a molecular level, and put my dog in full remission of cancer. So there's, it's interesting. I'm just a poor country boy from Pennsylvania, but if I can do that, imagine what somebody that's a doctor could do. It's just they don't think out of the box, and these tools give you superpowers. By the way, for the folks out there, the stem cells, the mesenchymal stem cells, I've seen people with Alzheimer's, dementia. Mel Gibson's father had heart attacks, and actually the stem cells went in and repaired a lot of the damage to his heart. And he actually lived from 92 to 101 because of doing the mesenchymal stem cells. So these frontier sciences are important. Not everybody, by the way, wants us to get better, right? There are companies out there that get, they're paying prescriptions every month, and it's a subscription model. And, they don't want you cured because that's how they make their money. We've got to go down through and solve a lot of these problems. And early detection is, the Germans have a phrase, Gestalt, the sum of the parts equal the whole. And one of the companies that I spoke to recently is funded by one of the billionaires because his father had Alzheimer's, but they use harmonic resonance at a cellular level. And so they actually can detect diseases using harmonic resonance. But here's the thing, it's really interesting. I don't know if you remember from physics, but you can actually, on one side, you can intercept, but on the other side, you can transmit. And you can actually change the cell, right, which is a different deal. So those frequencies, once you tune into that cell, you can go back and change it. And it's kind of like Star Trek kind of thing, like a tricorder in Star Trek.
Right. Yeah.
it's real. And these are the kind of things we ought to be exploring and figure out, instead of having to go in and get all these cancer therapies and all that. Take care of it before it's a problem, right?
Yeah.
And then,
And one of the things, sorry, Gary, that you mentioned, I wanted to point out, which is, the cost and how, the incentivizations are a little bit, especially in kidney disease, are a challenge. So, for example, close to $1.6 trillion a year in kidney disease treatment spend of the 10% of people in the world that actually have been diagnosed. And most of that money is in, probably over 2/3 is in the last stage, mostly in dialysis and treating, so stage 4, stage 5. So in
yeah,
other words, really poor outcomes. They're going out the door. But
yeah,
that's also, unfortunately, in the United States, that's a big moneymaker, right? And it's the one thing that people don't realize in the United States. It was Richard Nixon in 1974 put into Medicare a law that any American who needs dialysis gets it for free. That's still the case. And a lot of people don't realize there is socialized medicine in the United States. It's dialysis. The problem is, in talking to nephrologists and physicians around the world, they'll tell you prevention is the way to go. If we can prevent it
no,
earlier,
I agree. And that you
changes.
don't know what you don't know. And the problem is, you go into a doctor every year, but what
Yeah,
happens is the day after you leave the doctor's office, you start getting kidney disease. By the time you go back,
yeah,
it's freaking stage 4, and you
yeah,
start talking about a transplant. It's just
yeah,
crazy. But that's part of the problem. So we got to use tools to be able to continuously sense. The more we know, the more we can take care of it before it's a problem. I mean, like me with the kidney disease, thank God I went into my doctor and
mhm,
he told me what I had before, and I was able to do something. He told me, well, I don't know, there's no really cure for this thing, and et cetera. But I went over and I found it. I'm like, wow, this is unbelievable.
yeah, yeah.
There are cures.
Absolutely. And I think what you've done is really unique. And I think one day it would be amazing if everybody could actually get access to such stem cell treatments. I think that's fantastic. But I think even in the interim, there's just so many patients out there, so many people out there becoming kidney patients without knowing it. And one of the interesting things is we have all heard that diabetes is called the silent killer. I would argue, though, that it's often that kidney disease is a silent endpoint. And diabetes, of course, quietly damages kidneys, other organs, vessels, nerves, heart, the eyes. And because decline is silent, it's catastrophic by the time you get there.
Yeah.
So
Yeah.
if we can change that slope by getting upstream and giving people physicians an opportunity, which then gives people an opportunity, because there's no symptoms, people are not going to be able to. They're not going to. I feel great. Everything's fine. That was like my mom almost to the last. Oh, I'm fine. Everything's great. And then all of a sudden, it's just a really slippery slope.
No, I agree. And but what's going to change? If you can live another 10 years, you'll probably live another 20, right? With the
Yeah.
frontier sciences, because there are people just like yourself that are coming out with. I had one of the companies that I did uh, took iodine and molecularly isolated iodine and made it 1,000 times more powerful. Most people don't realize that iodine, when you put it on your skin and you go into surgery, it lasts a few seconds, and then if something goes on top of it, you get infected, right? The
Right.
bacteria. But they've
Yep.
made it so it can last days. So if you're,
Wow.
and
Amazing.
imagine what the possibilities of that. I have
Yeah.
another company that takes medical imaging and makes the image about 1,000 times again more powerful.
Mm-hmm.
And they sign deals with companies like GE and Siemens.
Mm-hmm.
So these frontier sciences are coming. The problem is you don't know how to find out, right? So there's a lot of folks with kidney disease that don't know about the stem cell treatment that I had done.
Yeah, absolutely.
You know,
Well,
and
part of the problem is a lot of people have kidney disease and they have no clue they have it. That's the first thing. If you can
well,
identify them. So, even with your case, it's like, how do we identify them so they can even get treated? Today, there isn't a way to identify them easily, often until it's too late, because nobody goes and takes all the blood work every week, right? If you're lucky, they go once a year, they get the blood work. If you're lucky, doctors nowadays are ensuring all patients get EGFR, UACR, all the various markers. But even if you do, you'll find out most often too late.
yeah,
And because people don't feel anything, nobody shows up and says, "Oh, I'm not feeling good. Oh, you got kidney disease." Well, if that's the case, you're probably stage 4 or 5 already, unfortunately.
Well, it's the same thing with liver, right? And my part it was ibuprofen because my sciatica was so bad that
Right.
I took the ibuprofen. I couldn't sleep. Like I'd
Yeah.
be up all night long in
Yeah.
pain, and it was like,
Yeah.
what would you rather have? Like,
Yeah.
you get a little loopy if you don't sleep 3 or 4 days in a row.
Yeah. And we all know about, opioids and how a lot of patients have been taking them for back pain and other pain. And if you look at the data, a lot of them often end up with kidney disease because it
Yeah,
damages the kidneys. It's not good for the kidneys. But then people are suffering, right? They're feeling pain. And this is where it starts. And this is the thing that astonishes me, right? And it's just, human nature as well. If we don't feel it, it doesn't exist.
yeah,
And that's not the case, right? And so I think that's where physicians come in. If we can empower physicians with more information, allowing them to identify the risk upstream, your physicians can come in and say, hey, look, I looked at these physiological results. Fourth Vital has detected an anomaly. I'm going to try this, letting you know what I'm doing. Honestly, it can be diet electrolyte changes, as simple as that. Of course, there are prophylactics, but again, the physician has an opportunity to try things and see if it works for that patient. And eventually, using AI, what we believe is that we can not only take the personalized vector that measures how that changes, over time in the body, but what happens when physicians intervene and making sure that the treatments are tailored and personalized for each patient. And the thing that excites us the most is the following. We're detecting a signal that's been clinically proven that actually can detect, predates the damage not only to the kidneys, but other disease states as well. It's all clinically published. And we're taking that along with other signals and using AI to basically increase the pool of patients that you can detect much earlier. Now, we're still in clinical validation, and right now we're looking at expanding in other parts of the world. We're in Turkey right now where there's some interest. And, it's the same story everywhere you hear about. Turkey has a population, I think, of like, whoever you ask about 80 to 90 million people. And it's believed that 15 to 17 million people have kidney disease. That's huge for the population, and 90% don't have a clue. So looking at all these numbers around the world, whatever we can do, it doesn't just apply for kidney disease. Whatever we can do in the future to use these signals and use AI to basically detect, how these signals are morphing and changing, and then basically allow physicians to intervene in countless ways, and then intervene in ways that are tailored to each patient. I think that's where the power of AI truly is in healthcare, and we've only just touched the surface of it.
no, it sounds great. Listen, we're coming up to the top of the show. Closing thoughts, and how do people get a hold of you?
Yeah. So, first of all, thank you again, Gary, for having me here. As you said, this is a very personal passion project for me. I really don't want others to experience what I and our family had to. And I think there's a huge opportunity. Our website is https www.fourthvital.ai. Fourthvital.ai is how they can reach me. And my email address is there as well. But yeah, really excited to chat with you. And I really think this is just a start of something that we can do together, and really save a lot of lives in the future, and really focus on the early detection that is greatly missing today.
No, it's great. You're doing a great job, and I really appreciate you coming on the show today. If you want to
Thank you.
stay on for a couple of minutes afterwards, we can
Sure.
talk. And to all
Sounds
of you,
good.
thank you for joining one more time. And thanks to all of you. We're over 1,700 podcasts reaching out to about 80 countries worldwide. And it's thanks to all of you here bringing incredible technologies, people that can help us with our future, with the healthcare, with all kinds of things that make our lives better. So my name is Gary Fowler, and I'm your host. Stay happy, stay safe, and stay healthy. And I'll be back to you again soon with another exciting edition. Thank you, everybody. Thank you.
Thanks, everybody.